Hi everyone, welcome to my presentation. My name is Grace Boulton and I will be spending the next 20 minutes talking to you about whether a single self-compassion audio can help increase our self-compassion. Before we begin, I'd like to explain a little bit about why I chose this topic. This is an area I've become personally interested in, particularly through developing an interest in mindfulness and using it during times where I feel stressed. Through that, I've become more aware of how easy it is to become self-critical. I think that's something many of us can relate to. We all have those difficult days where everything feels overwhelming or challenging, and in those moments, we often speak to ourselves in ways we wouldn't speak to others. Because of that, I became interested in exploring this topic further, and whether something as simple as a short audio could be a valuable tool for supporting self-compassion. So firstly, defining what self-compassion is. So the concept of self-compassion originates from Buddhist philosophy and was integrated into Western psychology by Kristin Neff in 2003. She conceptualized it into three interconnected components. These are self-kindness, where we treat ourselves with the same warmth as we would a friend, common humanity, where we recognize that suffering is a part of life, and mindfulness, where we acknowledge and name our difficulty as a moment of suffering. The social mentality theory explains how, from an evolutionary standpoint, self-compassion activates our self-soothing system while inhibiting the threat system through decreasing amygdala activity, and this makes us feel safe and emotionally regulated. From a developmental perspective, the attachment theory proposes that secure early attachments increase this ability to self-soothe, helping to create a sense of internalized compassion through social safeness. And this helps protect against psychological distress experienced in later life. In terms of the research around self-compassion, there is a large evidence base around the strong link self-compassion has to mental well-being. It is shown to help with stress, depression, anxiety, and life satisfaction, while increasing resilience to stressful events. In the counselling field specifically, compassion-focused therapy draws on these evolutionary, neurological, and developmental psychology, aiming to enhance an individual's ability to self-soothe through the use of techniques such as imagery and mindfulness. And this is shown to be effective in increasing self-compassion and decreasing self-criticism and depression. However, a lot of the research on self-compassion training has focused on more intensive multi-session interventions. For example, one of the most well-known programs, the Mindful Self-Compassion Program, runs over 8 weeks. Similarly, mindfulness-based interventions are typically delivered as structured programs over several weeks. So while these approaches are effective, they can present challenges in terms of accessibility, particularly due to the time commitment and ongoing engagement they require with daily exercises. As a result from this, there has been growing interest in developing shorter and less complex interventions. This would be useful for people who struggle to commit to this type of intervention, helping to make self-compassion practices more accessible to a wider range of people. Brief self-compassion and mindfulness-based interventions have shown promising effects on mental well-being. There is also some emerging research on self-compassion audios, which suggest benefits for outcomes such as stress, anxiety, and depression. However, these interventions still tend to involve repeated use over 2 to 3 weeks. Therefore, no study has specifically examined whether a single self-compassion audio could improve self-compassion. Such an intervention could provide a scalable, cost-effective, and easily accessible tool, particularly within the use of counselling settings. So what was the aim of the study? The present study aimed to address the research gap and explore whether a single 5-minute self-compassion audio could increase self-compassion. From this, we hypothesized that participants in the audio group would show significantly greater increases in self-compassion compared to those in the silence group. So we predicted that a single brief self-compassion audio would be sufficient to produce a measurable increase within self-compassion. How did we go about carrying out this study? So we used opportunity sampling to recruit 137 participants. However, due to incomplete data, only 85 of these were included in the data analysis. Inclusion criteria included participants that were over the age of 18, with no exclusion based on age, gender, sexuality, ethnicity, or nationality. Participants were recruited through Bangor University's Sona system, social media, or word of mouth. We collected information on demographics including sex, gender identity, and age in order to check for any bias. Participants were randomly allocated to either the 5-minute audio or the 5-minute silence condition. So the study used a quantitative 2x2 mixed measures design. Our first independent variable was time before and after the intervention, and the second independent variable was group, the audio or silence condition. Our dependent variable was self-compassion score. The study was accessible for English or Welsh for accessibility, and ethical approval was obtained from the Bangor University School of Psychology Research Ethics and Governance Committee. The study adheres to the BPS and BACP guidelines for ethical research and practice. Participants accessed our study through SciToolkit. Participants gained informed consent and were kept anonymous for confidentiality and informed they could withdraw from the study at any point. So to measure self-compassion levels, the state self-compassion scale was used. This is a validated measure that consists of asking you to think about a difficult or a painful situation you are experiencing and indicate through 18 statements how you feel about yourself in the context of that situation. And this is measured on a Likert scale of 1 to 5. This questionnaire was a later development to the original self-compassion scale, which measured trait self-compassion. Measuring state self-compassion is theoretically important for capturing short-term effects, as it can be context-dependent and fluctuate depending on your mood. 6 subscales are measured on the state self-compassion scale with 3 positive components, self-kindness, common humanity, and mindfulness, and 3 opposite negative components, self-judgment, isolation, and over-identification. All participants were asked to complete the state self-compassion scale before and after the intervention. The intervention we used was called the Self-Compassion Break, developed by Kristen Neff, and this mirrors the state self-compassion scale and asks you to think about a difficult situation in your life right now. The guided audio uses the 3 components of self-compassion: mindfulness, self-kindness, and common humanity, and these are applied to the difficult situation. Participants that were assigned to the control group sat in silence for 5 minutes. Following this, participants were asked reflective questions on their experience of the intervention, on how helpful they found the activity, whether they would do it again, and whether they would recommend it to others. The study was conducted online to increase accessibility so participants could be in a comfortable environment. At the end of the study, participants were provided with a debrief and signposted to support options for any mild distress that may have arisen. So what did the findings show? Firstly, looking at the demographics, participants ranged in age from 18 to 54 years. For sex, 68 participants reported being female, 15 male, and 2 preferred not to say. And for gender identity, 67 identified as women, 14 identified as men, 1 identified as non-binary, and 3 preferred not to say. A chi-square test revealed no significant difference between the audio and silence group for sex or gender identity. However, an independent samples t-test revealed there was a significant difference in age between the groups. To explore whether there was a significant difference between the conditions for self-compassion scores, a 2x2 within subjects repeated measure ANOVA was run. From this, we found there was no significant difference between time and group for self-compassion scores. However, we did find a significant difference was found for time pre- and post-intervention. This is visible in both the lines increasing on the graph. So moving on to the subscales, as the total self-compassion score showed no significant difference between conditions, I conducted further analysis to explore whether any specific components of self-compassion were significant. As a reminder, the self-compassion scale includes 3 positive components, self-kindness, common humanity, and mindfulness, and 3 negative components, self-judgment, isolation, and over-identification. So I conducted a 2x2 repeated measures ANOVA for each subscale. The results showed that the mindfulness subscale was significant for both time and group. As illustrated in the graph, both conditions showed an increase, however the audio condition line increased more steeply. To further validate this finding, a Bonferroni correction was applied. The effect remained significant, reducing the chance of this being a type 1 error and increasing confidence in the reliability of this result. So moving on to what all this means. So as a reminder, the study explored the effect of a brief single guided audio on self-compassion. and we hypothesized that exposure to a 5-minute self-compassion audio will increase self-compassion significantly compared to the silence control, and from our results, this hypothesis could not be supported. This suggests that a single brief exposure to the 3 components may not be enough to increase self-compassion. This finding differs from previous studies carried out around self-compassion, and it is the first study to explore the effectiveness of a standalone self-compassion exercise rather than a measure of repeated exposure. This suggests that repeated exposure may be necessary before changes in total self-compassion are measurable, and so future research should continue to investigate the relationship between frequency of exposure and outcome. However, there was a significant difference for time for both groups, and although this is not central to our research question, it may suggest that even the silence condition provided an opportunity for reflection or a pause, which could have influenced scores. Participants' responses to the reflective questions at the end of the questionnaire showed that participants in the audio group responded more positively overall to the intervention. This indicates that participants may have found the audio useful as a calming and relaxing tool. The mindfulness findings suggest that the audio may provide present moment awareness and relaxation. This supports previous study on mindfulness-based interventions, highlighting its value in even a brief format of 5 minutes. The audio format may be particularly well suited to the mindfulness component with guided instruction to bring attention to the present moment, as mindfulness practice often use guided audio. So what implications does this have for the counselling field? So firstly, looking at the theoretical implications. The study provides partial support for the self-compassion theory based on the 3 core components: self-kindness, common humanity, and mindfulness. The lack of a significant change in total self-compassion suggests that a single brief exposure may not be sufficient to influence all 3 of these components, suggesting longer-term or repeated engagement may be needed. However, the significant increase in mindfulness suggests that not all components are equally responsive. Mindfulness appears to be more immediately accessible in a brief intervention. Previous research has shown that a single mindfulness intervention can enhance attention, cognitive flexibility, and inhibition without any previous experience. This finding raises an important theoretical implication that mindfulness may provide a gateway into self-compassion. It could be the first process to shift, potentially facilitating the development of self-kindness and common humanity over time, which may require deeper cognitive and emotional shifts, typically developed through more sustained practice. This suggests it would be useful as an introductory tool. The variation across subscales suggests that while the theory presents self-compassion as an integrated construct, its components may differ in how quickly they respond. This highlights the need for future research to explore the individual responsiveness of each of these components. In terms of the practical implications, this study is particularly relevant to the counselling field. Although the study did not significantly increase overall self-compassion, the improvement in mindfulness suggests that a brief 5-minute audio intervention can still offer immediate benefits for present moment awareness. This is a core skill underpinning many therapeutic approaches, including acceptance and commitment therapy, dialectical behaviour therapy, and other mindfulness-informed interventions. In practice, this type of audio could serve as a low-cost and accessible tool for counsellors to recommend to clients, particularly for use between sessions. It may help clients engage independently with practices and create a sense of calm that supports deeper therapeutic work, complementing the therapeutic process. This study contributes to the increasing use of digital tools in mental health support. Audio-based interventions are scalable, accessible, and can reach individuals who may not otherwise seek support. This also may be especially beneficial for clients who find longer and more intensive practices overwhelming, as a short guided format requires minimal time commitment and no prior experience. Beyond client use, there are also implications for counsellor well-being. Given the high risk of burnout and compassion fatigue that can occur, brief self-compassion tools like this can provide a practical way for counsellors to support their own mental health. This may be particularly useful for trainees who often experience high levels of self-criticism and self-doubt while on placement. A short audio intervention like this could be easily integrated. So what are some of the limitations of this study and suggestions for future research? So the online format was chosen to maximise accessibility. However, with this, engagement and compliance could not be guaranteed despite steps taken to minimise distractions, such as asking participants to wear headphones and to be in a quiet environment. Any distractions experienced during the audio may have directly influenced participants' responses on the state self-compassion scale, which could have obscured some of the effects. Replicating this study in a more controlled setting would increase experimental control and help address the engagement concerns discussed. The timing of the data collection may have also contributed to the result. Data collection took place during the examination period in January at Bangor University. As many of the participants were university students recruited through SONA, academic stress during this period may have influenced emotional states that could have reduced the effectiveness of the intervention. Future research could conduct the study in a lower stress period, which would help minimise contextual factors. The reliability of each of the 6 subscales in the state self-compassion scale has received little psychometric testing. Therefore, the significant mindfulness findings should be interpreted with caution, and future research could look into the psychometric properties and the reliability of subscale scores. The demographics of the sample may also have had an effect, as the results found a significant difference in age observed between groups, which could be impactful given some evidence suggests that self-compassion can differ with age. Furthermore, the sample was predominantly female, meaning the generalizability of the present findings to male populations is limited. Future studies could try and create a balanced sample in both the intervention and control. Given that the audio intervention did not produce a significant change in overall self-compassion, future research could explore whether repeated daily use of the audio is effective in increasing self-compassion. To examine this, a longitudinal study with weekly time points could enable measurement of change in the 3 core self-compassion elements. This would help clarify whether the limited effects in the study reflect the briefity of the audio or the absence of repeated exposure. Establishing the optimal frequency and duration would create a better understanding of how best to achieve all 3 self-compassion components. And finally, by focusing solely on state self-compassion, the present study may have overlooked the benefits of the audio for general psychological well-being. Future research could measure a wider range of outcomes alongside self-compassion to establish the short-term effects of a brief audio-based intervention on mental health. So to finish, I'd like to leave you with a take-home message from this study. Self-compassion plays an important role in our everyday lives, as everyone experiences stress, difficulties, and moments of self-criticism. While exposure to a single 5-minute self-compassion audio may not be enough to increase self-compassion, it did improve mindfulness, helping to promote present moment awareness, calmness, and emotional regulation. These findings suggest that a short guided practice may provide a valuable and accessible introduction to self-compassion within counselling settings, supporting both client and counsellor well-being. So that brings us to the end of this presentation. Thank you very much for listening, and please feel free to email me for any questions you may have following this. Thank you.